Finally, we arrive at the crucial intersection of psychotherapy and cultural considerations. In this third section, we'll address the role of culture in mental health treatment, discussing potential biases in diagnosis, the importance of culturally sensitive therapeutic approaches, and the complexities of navigating diverse societal influences in the provision of effective mental health care. So we'll discuss how cultural background can influence the way mental health professionals diagnose patients here. And this includes how therapists' schemas, biases, and expectations can lead to misdiagnoses, and of course, how cultural factors can influence how symptoms are expressed and perceived. It's essential to acknowledge that we all carry our own cultural baggage, our own values, beliefs, and assumptions. So psychologists and other mental health professionals can have their own issues as far as biases with illness, and these can influence how they perceive and diagnose patients. For example, a therapist who is raised in a culture that values individualism may be more likely to diagnose a patient with depression if the patient expresses feelings of sadness or isolation. Additionally, diagnoses that are made in one culture may not be generalizable to other cultures. For example, symptoms of anxiety may be expressed differently, um, and it's important to remember that not all people from the same culture will share the same norms. So, some people from collectivist culture may be more likely to seek help from family members or from mental health professionals for problems, while others may be more likely to seek help from professionals. Cultural contexts shape how mental health conditions are diagnosed. Symptoms may be expressed differently across cultures, leading to variations in diagnosis and treatment approaches. Now, as far as therapeutic effectiveness, the effectiveness of psychotherapy can vary based on cultural factors. So what works well in one context may not be equally effective in another. There's cultural norms, beliefs, and values that impact how individuals perceive and respond to therapy. So in this case, therapists need cultural competence to provide effective care. And this involves understanding cultural differences, being aware of biases, and adapting therapeutic techniques to meet the unique needs of diverse clients. Western psychotherapy models such as cognitive behavioral therapy, psychodynamic therapy, and humanistic approaches are being exported to non-Western countries. And while this is done with good intentions, it's essential to recognize that these practices may not align with local cultural values and beliefs. Rather than imposing Western models, there is a growing awareness of the need for cultural adaptation. So, integrating indigenous healing practices with culturally adapted counseling and psychotherapy can reduce international mental health disparities. Globalization presents both challenges and opportunities. Therapists must navigate cultural nuances, address stigma, and promote mental health awareness worldwide. And by embracing diversity and learning from various cultural perspectives, psychotherapy can evolve and become more effective globally. And cultures may express distress in different ways. For example, some cultures may be more likely to somatize their distress, meaning that they may express emotional problems through physical symptoms. Additionally, what's considered to be a mental health problem in one culture may not be in another. For instance, nightmares may be seen as spiritual experiences in some cultures, while they may be seen as a sign of mental illness in others. And similarly, some disorders can be difficult to diagnose across cultures. For example, a neurological disorder that's diagnosed in China may not be easily diagnosed by a Western mental health professional. Additionally, symptoms of mental illness can be interpreted differently depending on the culture. And while there can be challenges in diagnosing mental health conditions across cultures, some disorders appear to be consistent. For example, studies have shown that attention deficit hyperactivity disorder is diagnosed at similar rates in many different cultures. And culture can also play a role in psychotherapy. So treatment programs that are designed for one culture may not be effective for another. And additionally, individuals in cultures that are more tolerant of mental illness may be more likely to seek help and to benefit from treatment. The stigma of mental illness can prevent people from seeking help as well, and this is a problem in all cultures, but it may be especially problematic in cultures that actually have issues with sharing public knowledge. Culturally sensitive therapeutic approaches, including non-traditional therapies and integrating spiritual healing practices, are important as well as the client-therapist relationship and ethnic match. And to conclude, I want to leave you all with a final thought, a quote from American author James Branch Cabell. The optimist proclaims that we live in the best of all possible worlds, and the pessimist fears this is true. And this quote, while not directly about mental illness, speaks to the range of perspectives we bring to any complex issue. When it comes to understanding and addressing psychological disorders in a global context, it's crucial to acknowledge the diversity of human experience, the influence of culture, and the need for both optimism in our pursuit for healing and a critical awareness of the challenges that we face. And so, in this final summary of section 3, we've emphasized the critical role of cultural considerations in psychotherapy. We've discussed the potential for psychodiagnostic biases, highlighting how a professional's cultural background can influence the perception and interpretation of behavior. We also explored the significant role that culture plays in psychotherapy, affecting treatment approaches and their effectiveness. And finally, we underscored the importance of cross-cultural sensitivity in treatment, including the integration of non-traditional therapies and client-therapist relationship to provide culturally competent care. And to encapsulate the chapter, we've explored the relativist and universalist perspective on psychological disorders, understanding how culture shapes our view of mental illness. We've emphasized the importance of considering cultural context in clinical care from diagnosis to treatment. We've also examined the DSM-5 and the concepts of cultural syndromes, which are unique to specific cultures. Furthermore, we've highlighted the cultural variations in manifestation and understanding of various disorders, including schizophrenia, depression, anxiety, and personality disorders. We've also addressed the cultural factors influencing suicide, substance use, and abuse. And finally, we discussed the potential for bias in professional perceptions and the crucial role of cultural sensitivity in psychotherapy and treatment. And this is to ensure effective and culturally competent care. Thank you so much for tuning in, and please feel free to address these questions in the comments below. 1, how can clinicians balance the universal understanding of mental disorders with the need for culturally specific treatment approaches? 2, what are the potential benefits and drawbacks of integrating traditional healing practices into modern psychotherapy? 3, in what ways can cultural sensitivity training for mental health professionals be improved to address the diverse needs of clients from various backgrounds? And 4, how do cultural factors influence the perception and experience of mental health stigma? And what strategies can be used to reduce this stigma in different communities?